Let's start. Breathing. Something we often take for granted until it becomes a struggle. Today, we're diving deep into two conditions that can make each breath a challenge: asthma and bronchitis. They may sound similar and even feel alike sometimes, but they are two very different respiratory conditions. Understanding the difference could be the first step toward a healthier, more empowered life. What is asthma? Let's begin with asthma. Asthma is a chronic condition, meaning it doesn't go away, but it can be managed. It causes inflammation and narrowing of the airways, making it harder to breathe. Triggers can include allergens like pollen, dust, cold air, exercise, or even stress. People with asthma often experience episodes of wheezing, shortness of breath, chest tightness, and coughing, especially at night or early morning. It's often genetic and typically shows up in childhood, but can occur at any age. What is bronchitis? Bronchitis, on the other hand, refers to inflammation of the bronchial tubes, the air passages that lead to your lungs. There are two types, acute and chronic. Acute bronchitis is usually caused by viruses and often follows a cold or flu. It lasts a few days to a couple of weeks. Chronic bronchitis is more serious. It's a long-term condition often caused by smoking or air pollution, and it's part of a group of diseases called COPD, chronic obstructive pulmonary disease. While both forms cause coughing and mucus, chronic bronchitis can lead to permanent lung damage over time. Symptoms: what sets them apart? Let's compare symptoms. Asthma often causes a dry cough, chest tightness, wheezing, and shortness of breath. It comes and goes. Bronchitis, especially the acute form, typically includes a wet cough with mucus, fatigue, low fever, and chest discomfort. In asthma, the symptoms are usually triggered, while bronchitis symptoms are more constant once it begins. Understanding these subtle differences helps in choosing the right treatment and avoiding complications. Causes and risk factors. Asthma is commonly linked to genetics, environmental allergens, pollution, or occupational exposure. Bronchitis, especially chronic bronchitis, is heavily tied to smoking and prolonged exposure to irritants, like fumes or industrial dust. Your environment, lifestyle, and even the air quality where you live, whether in India's metros or North America's cold climates, can all play a role. Taking action on what you can control is key. Treatment and management. Asthma is typically treated with inhalers, controllers for daily use, and relievers for emergencies. It's about long-term management and reducing flare-ups. Bronchitis, particularly acute bronchitis, often resolves on its own with rest, hydration, and sometimes antibiotics if there's a bacterial infection. Chronic bronchitis may require inhalers, oxygen therapy, and long-term care. But the good news? Both conditions can be managed with lifestyle changes, awareness, and timely care. Frequently asked question. Question 1. Can asthma turn into bronchitis? Answer is no, but people with asthma are more prone to getting acute bronchitis due to increased sensitivity in the airways. Question 2. Can you have both asthma and bronchitis? Answer is yes. This is sometimes referred to as asthmatic bronchitis, and it requires careful treatment. Question 3. Can lifestyle changes really help? Answer is absolutely. Quitting smoking, avoiding triggers, staying active, and breathing clean air can make a huge difference. Question 4. When should I see a doctor? Answer is, if you have persistent cough, breathing difficulty, wheezing, or mucus production for more than a few days, don't wait. Early diagnosis changes everything. The power to breathe better starts with knowledge. Whether it's asthma, bronchitis, or both, you have more control than you think. Stay proactive, stay informed, and most importantly, stay inspired. If this video helped you, don't forget to like, share, and subscribe. Your journey to a disease-free, wealthy lifestyle begins with a single breath.